Hi, my name is Maggie Rosinski, and in this video I will be detailing my personal approach to counseling. So I'm going to start off by going over my perspective on human development, which will include my perspective on client change. Then I will discuss my primary theory, detailing relevant interventions and then applications into my future career. And finally, I'll go over my personal approach to cultural competency and assessment. So my beliefs about human development have been primarily shaped by two influences, which are social learning theory and sociocultural theory. So social learning theory is a very basic, fundamental part of behavioralism, and it posits that the environment influences human learning and development, and that people learn by reproducing the behaviors of those observed around them. So while it's pretty clear by just observation and also empirical evidence that children do learn by reproducing behaviors within their environment, the social learning theory does not tell us everything about the sociological factors that create environments and influence people as they develop. And that's where sociocultural theory comes in. Sociocultural theory states that human development is impacted by cultural and social systems. So by combining this idea with social learning theory, we can create a clear, if maybe a little bit general picture on how children learn. So for example, babies learn language by reproducing and imitating the language of those around them. And however, we can consider the fact that the creation of this language and the ways in which the child will use the language is also impacted by a variety of historical and contemporary sociological factors. So therefore, I can kind of sum up my belief about human development as this: environmental factors shaped by cultural and social influences drive human development. So if behaviors are learned from an individual's environment, how can people change their behaviors? So within the research of behavioralism, there's this idea of self-efficacy theory. And this has really influenced my perspective on client change. Self-efficacy theory states that a person is able to perform a task based on their beliefs of self-competency and the reinforcement that they have received from their environment. So as you will see, this idea that cognition and reinforcement are the two factors that are impacting behaviors really aligns with my theoretical orientation. So therefore, I believe that changing a client's negative cognitions combined with increasing environmental support results in positive behavioral change. So as you could probably guess from my approach to human development and change, my approach to counseling is mainly influenced by CBT, or cognitive behavioral therapy. And CBT operates on the idea that thoughts cause feelings and behaviors. So therefore, CBT interventions aim to change clients' thinking and their ways of processing their environment. There are many different CBT interventions, but they include stress inoculation training, exposure, habit reversal training, eye movement desensitization, and reprocessing. So somebody who really wants to work in an agency setting with individuals suffering from anxiety disorders, CBT is a very ideal approach, not only because it is evidence-based to be effective within this population, but also because it is time limited. So it's also very effective within an agency setting. So while I have less experience observing the clinical application of all of the different theories, I did want to talk a little bit about a theory that I think aligns very well with my theoretical orientation, and that is DBT, or dialectical behavioral therapy. So while DBT kind of comes out of the same wave of therapies as CBT, there are some differences between the two. So instead of focusing on the impacts of thoughts on behaviors, DBT focuses on the impacts of emotional dysregulation on behaviors. However, both CBT and DBT look at behavioral change as the main goal for clients within therapy. And DBT interventions are also looking at the impacts of cognitive processes on behaviors. So that really forms the basis of my theoretical orientation. So I believe that these two theories are similar and complementary. DBT interventions fall into 4 categories, which are mindfulness, developing interpersonal effectiveness, distress tolerance, and emotional regulation. And all of these things, as you can imagine, also fall into our cognitions and impact behaviors. So DBT also aligns well with my counseling perspective because it is evidence-based, structured, and time-limited. And therefore, it makes it very applicable within an agency or a private practice setting. So as a counselor, I will apply my cultural competencies to every aspect of counseling. As I mentioned earlier, the idea that cultural and social factors shape a person's action in their environment is very essential to my theoretical orientation. As somebody who studied sociology in undergrad, I think about sociological factors in every aspect of my life. And so being educated within cultural competencies and making that a part of my treatment is very important. And I believe that as members of various social and cultural structures, clients hold a variety of identities that are central to who they are. And really, one of our main jobs as a counselor is to recognize and affirm these identities because doing so is essential for supporting the mental health of clients. And this has been backed up by many studies within the literature. With this in mind, it's very important for my chosen theory to be effective with diverse populations. And the literature suggests that this is true for CBT, and CBT can even be altered to kind of account for some differing social and cultural factors within populations. Even though CBT is impactful with various diverse populations, as a counselor, it will still be important for me to recognize disparities in counseling, work to gain and maintain cultural competencies, provide clients with community resources throughout the course of treatment, and to advocate for a more diverse field. So as a counselor who mainly ascribes to cognitive and behavioral therapies, the most helpful assessments for my clinical work fall into kind of two groups. The first group is clinical assessments, and the second one is behavioral assessments. So clinical assessments might include something such as the GAD-7, the Beck Anxiety Inventory, or the PHQ-9. And these are going to provide information about a client's cognitions and emotions that impact their negative behaviors. On the other hand, behavioral assessments, such as the Behavioral Assessment System for Children, focus more on the behaviors exhibited by the client. So because the goals of my main theories are to alter cognitions to create behavioral change, both factors must be assessed for during the treatment process, so these kinds of assessments align best with that. So I hope this presentation allowed you to learn more about my approach to counseling, which as you can see is heavily influenced by behaviorism and CBT. Attached on this slide are my references, and thank you for watching.